What really happens in a double jaw surgery? Hi, I'm Dr. Suresh, Senior Consultant Maxillofacial Surgeon, Nasus Healthcare. There's one procedure which changes the facial appearance, the bite, the alignment of the jaws, and also the breathing problems. It basically enhances the overall confidence and self esteem of an individual. We call it as orthognathic surgery or a double jaw orthognathic surgery. What exactly happens? You have a patient for whom the upper jaw is forwardly placed, the lower jaw is backwardly placed, or the opposite of it. The lower jaw is forwardly placed and the upper jaw is backwardly placed. Instead of having a straight profile, the patient may have a convex or a concave profile. Many individuals doesn't know this can be corrected. Now, how can this be corrected? First, we need to evaluate clinically what is the defect. Whether the defect is in upper jaw, whether the defect is in lower jaw, or a combination of upper jaw and lower jaw. It starts with the patient examination, knowing the brief history, understanding what exactly the patient wants it. Unless we have a clear understanding between the doctor and patient what exactly is the patient is looking for, whether scientifically this can be achieved, and what are the procedures to achieve that and goal of the patient what is looking for. Then proceed with the clinical examination. Clinically, we'll see for the facial profile, the nose, the jaws, the malar prominence, the chin prominence, and overall length of the upper jaw and lower jaw. After that, the patient will be subjected to some x-rays, which we call it as lateral cephalogram. Lateral cephalogram study is a very important study where we quantitatively understand whether the upper jaw is excess or deficient, lower jaw is excess or deficient. So that gives a surgeon a clear information, millimeter by millimeter, quantitatively, scientifically authenticate what is the defect of the face. Based on that, the surgery will be planned. Most of these surgeries are done inside the mouth, that is intraoral. That means no scars on the face. The patient will be taken for complete anesthesia where the patient will not know any pain. If the defect is in upper jaw, the upper jaw is short, we are going to try to pull the upper jaw forward, or if the upper jaw is elongated or forwardly placed, then we will try to push the upper jaw back. Simultaneously, if the problem is also with the lower jaw, we are trying to correct the lower jaw forward if it is backwardly placed, or the opposite of it if it is forwardly placed, backward of the place. All these surgeries are done in a simple procedure where the patient doesn't have any pain. Now the recovery. Initial 2 to 3 days, patient will have some swelling, some discomfort, but not an unbearable pain. The recovery is fast. After the recovery, the patient will have a very enhanced facial appearance, the balance of the face, and patient will be able to chew normally. Most of the patients have a myth that these surgeries are very complicated, and most of the patients think that these surgeries are done with the scars on the face. The good news is there won't be any scars on the face. This is the beauty of orthognathic surgery or a cosmetic jaw surgery where the double jaw corrections are possible. Now, how to identify whether the individuals are having this jaw problem or not? Take a self-profile view picture. Draw a line from the glabella to the tip of the nose, one line, another line from the tip of the nose to the chin. If both these lines are straight, then you have a straight profile. In a concave profile, the lower line is forwardly placed. In a convex profile, the lower line is backwardly placed. See, the goal of surgery is to maintain these lines in a straight profile. So this is what is achieved in an orthognathic surgery or a cosmetic jaw surgery. If you find this information valuable, kindly share with the people who are in need of it. Thank you for watching this video.